having that position where I'm in our hospitals regularly helps me stay up to date with the clinical practice so that when my team is designing systems that are used in our hospitals, that they are effective systems, that they're the most up-to-date workflow with what's actually going on in our hospitals. My name is Charity Loput. I am a pharmacist by background, and I am the manager over orders and order sets for the Expanse build at the corporate office of HCA Healthcare. I work in Nashville, Tennessee, and I lead a team of clinical informaticists that help convert the legacy electronic health record to our newest version of the health record called Expanse. For those unfamiliar with HCA Healthcare, we are a large healthcare system composed of 182 hospitals and 2,300 sites of care across the United States and the UK. So we're really operating healthcare at a huge scale through this work. When people ask me what is clinical informatics, the way I think about clinical informatics is that we are professionals who take people, process, and technology and put that on top of the care that we're delivering. So we use technology as just another tool in our toolbox to enhance the patient care delivery process. So this could be through the electronic health record and different pathways or workflows that we can use to enhance that care delivery for our patients. This can also be through all of the ancillary systems that are connected to the electronic health record, the billing system, the automated dispensing cabinet system, and our medication delivery throughout the hospital, any systems that we use in the IV room. All of these things come together to be able to support the patient care when you're in our hospitals and when your family members are in our hospitals. So informaticists help set up and design those systems so that they're effective for the people using them, the nurses, physicians, respiratory therapists. All of those disciplines use technology in different ways. And as a clinical informaticist, it's my job to understand the clinical workflow and background and translate it into people, process, or technology. Often we come from the bedside. We have nurses and physicians that come from those practices, or our hospitals or our physicians' offices, and they create the technology and enhance the technology that is used to take care of our patients. I also PRN at TriStar Stonecrest Medical Center in Smyrna, Tennessee, and I'm a clinical and operational pharmacist there. And having that position where I'm in our hospitals regularly helps me stay up to date with the clinical practice so that when my team is designing systems that are used in our hospitals, that they are effective systems, that they're the most up-to-date workflow with what's actually going on in our hospitals. So a typical day for me is that we start our day with a morning huddle with my entire team of informaticists. During that huddle, we bring up questions that we have, different tickets that we're working on for the hospitals that are live on the software that we support, and anything else, any training opportunities or anything that my team identifies as something that we need to work on together. And it's such a great start to my day because I get to connect with the people that do this incredible work. And also as a manager, I see what are the roadblocks in their way to doing their best work. And I help remove those roadblocks so that they can provide this service to our hospitals. After our morning huddle, my day is usually filled with different kinds of meetings, whether these are meetings with our hospitals that we are supporting for the EHR implementation, whether it's with our service line leadership at the corporate office, those dialysis leaders, or those in our diet departments or supply chain that help provide the in-feeder for these services and that we have to design technology around. I also meet with my organizational leadership, making sure that we're following the plan of the implementation that we set for these hospitals, and that all of the pieces that we need to bring these hospitals live and avoid interruptions in care as they're going through the conversion process are followed through that plan. Some of the skills that I look for in my team are the ability to look at processes and improve those processes, or identify problems within those processes that we can solve through those three levers: people, process, and technology. Is there something wrong with the people portion of it? Is there some workflow that the user is doing that they don't understand? Is it process? Is the process around the system not working and we need to improve that? Or is it the technology? And that's where my team has the largest hand in the work, because we are changing the product to fit the needs of patient care. Some of the other skills that are helpful in a clinical informatics role include project management and being able to see the huge initiatives that we have for our hospitals and break them down into small steps and where the prioritization is for those steps so the hospital is ready on the go live day. What I like best about my role is that I get to support the team of experts. For the longest time as a pharmacy informaticist, I was the expert for the company in my specific area. And now as a manager, I get to support them in being the experts and resolve roadblocks or things that are preventing them from doing their best work, whether it is a conversation that I need to have with leadership, a conversation they need to have with leadership and they lead and they own their efforts, or whether it's something completely different, something with the technology or something with the way that we have our own processes set up that I can use their feedback to put back into the system so that we can continue to grow. If you're interested in a career in clinical informatics, then I suggest trying to meet someone or trying to network with people who are in these roles. There are a lot of different organizations that are centered around clinical informatics, including HIMSS, AHIMA, other organizations that you can connect into. Even ASHP has sections that are devoted to clinical informatics. And so talking to those people and seeing what are the day-to-day responsibilities, what are some things that are rewarding about your role, and also those things that are challenging about the role so that you can understand what to expect in those positions. And be creative. If you're interested in clinical informatics, healthcare as a whole has so many opportunities, and there are so many ways to get into the care process and the delivery of technology. So be creative about what kind of roles you're interested in. And as I said before, network, talk to people so you can identify what's important to you and what you're looking for in your own career. We are more.